Green Oak Initiative. We're sort of a small community mental health center placed at Basant Nagar. And I think many of you have been attending our Green Oak Expert Talk happening every month. So, and I can also see a lot of new people who have joined. So, welcome to all of you. Now, today's topic is again on building bridges, managing families in the context of working with children and adolescents in mental health. So for today's topic, we have Dr. Sreyoshi Ghosh, who's probably the perfect fit for this topic. So she's a consultant child and adolescent psychiatrist practicing in Bangalore. And of course, her areas of interest are child and adolescent psychotherapy and adolescent suicide prevention. After completing her DM in child and adolescent psychiatry from NIMHANS, she's acquired again additional training in MBT, mentalization-based therapy, and systemic family therapy. She's also now part of an advanced training program in relational gestalt therapy, which is going on. Welcome, Dr. Sreyoshi Ghosh, and thank you for doing this. Now, before we start, maybe I would request all of you to mute your microphones so that the session is undisturbed. And if any questions come up for you, you can always just put it up in the chat box. We'll probably address them in the end. So maybe without further ado, the floor is yours, Dr. Sreyoshi. You can probably start.
Thank you so much, Dr. Ruchi. It's just really been wonderful, to know all of you at Green Oak and to have worked with so many of you. And I've been meaning to do this talk for a while, and I'm happy we could finally work it out today. So I'll just take a minute to just share my slides, and Ruth, you can let me know if they're visible.
It's visible.
The full screen is visible, right?
Yeah, full screen is visible.
Okay, perfect. Right. So today I'll be talking about a part of our work with children and adolescents that leaves many of us, including myself, filled with a lot of uncertainty, anxiety, not really knowing how to navigate. So by no means do I feel like I have a complete hold on how to work with the parents of children and adolescents who come to me. But what I've tried to do today is to really reflect and then take you through some of the points from the available literature that I have encountered during my training and that I often reference, because it's useful to know what is really out there, what are some of the evidence-based interventions that have some research base, and then I'll go on to really let you know about how I have interpreted some of this literature and how I use it in my practice, some of the challenges that I encountered, and some of those will be perhaps unique to also those of us who are psychiatrists but who also do some psychotherapeutic work, right? It may not be challenges that apply to everyone. A few case vignettes from my practice, where I feel that there may be some learning and discussion points, especially with regards to parent work, a summary of what has worked and what hasn't in my experience, and then we'll go on to the discussion. So I got so many of the questions that you all had sent me yesterday evening, and thank you for thinking through this and also giving me some thoughts about what may be some of the elements that we may want to focus more. So I won't take too much time with my talk. If there's something that you feel I've skimmed over, something that you feel we can talk more about, then please feel free to bring that up during the discussion. So, attachment based interventions and attachment theory is something that I keep going back to time and again. And I was exposed to attachment based family therapy during a workshop during a international clinical psychology conference, and it really opened my eyes about how attachment based work is relevant not only in early infancy and childhood, but also for older children and adolescents. And the usefulness of it is that it's very clearly structured. There are certain tasks that you have to take the child and the family through. So you first do what is called a relational reframe, where you're essentially shifting the focus from the child being the problem to the relationships within the family between the child and his or her parents being something of a solution. So you're reframing that. Then it involves some sessions with the adolescent separately, some sessions with the parents separately, just to understand where attachment ruptures may have happened, what some of the barriers may be in the adolescent's mind to really sharing and communicating distress with parents, where have parents' own ideas and thoughts about attachment, how has that been shaped? So, just to have an idea and then prepare them for a joint session wherein you are actually trying to repair the attachment ruptures that you have identified. And there's quite a bit of evidence, especially for ADFT, for adolescent depression, even adolescents who are quite suicidal. And I have personally found some elements of this quite useful. So it's also helpful to kind of go back to what some of the pioneers of these theories did say, and I found it quite useful to read this paragraph about what John Bowlby had said about working with parents. And he said that I've quoted him, that a weekly interview in which their problems are approached analytically and traced back into their childhood is sometimes remarkably successful. And having once been helped to recognize and recapture the feelings which she herself had as a child, and to find that they are accepted tolerantly and understandingly, a mother will become increasingly sympathetic and tolerant towards the same things in her child. So even in models of child and adolescent psychotherapy, which are more based on CBT, like for example, the coping cat model, which has been extensively researched for childhood anxiety, even there are pointers as to how to involve caretakers, right? So firstly, of course, from providing information and then being collaborator, so to assist with the child's acquisition of coping skills. So it's actually advised to let the parents know about what sort of skills you're trying to teach the child, whether it's different kinds of relaxation skills, whether it's cognitive restructuring, and also to bank on their involvement when it comes to behavioral experiments, when it comes to exposures, all of which are important when we are trying to help an anxious child. When it comes to OCD, something that we all, of course, know is that there is this component of family accommodation, and that is something that we must address. But looking more closely at some of the research on childhood OCD and the families of these children with OCD has really shown us that there is a worse response associated with high risk families, right? So, especially families where there is higher parental blame, there's greater family conflict and lower family cohesion. And each of these will contribute like one risk status. So when the risk, say, supposing the family has all three of those, risk factors, and the response rate to standard interventions becomes really low, which really shows us um, how much we have to look at what is happening in the families of these children and think about how we want to intervene. Which is also why I've noticed that, and when I used to work at NIMHANS, that it used to be helpful to admit, children who are so-called treatment resistant, right? Because it's difficult to do a lot of intensive work with parents and families on an outpatient basis. It's not always easy, but I think that is something that we would do intensively when they were admitted with us, like really work with the families and really um, look at some of these elements, and that's certainly something that has helped. And so with this research, again, there have been interventions designed to act as adjunct to standard CBT for high-risk families, which focus on affect regulation, parenting skills, and how to sort out complex family dynamics. And definitely with family enhanced CBT, the response and remission rates significantly improve. So this is a girl, and the reason I'm putting this vignette here is because she did have ADHD, eating disorder, and also OCD. And uh, what what didn't sort of strike me towards the beginning is how much the family factors and the parent-related psychopathology was in fact influencing the entire presentation. So her mother would be someone who would take up most of the time during sessions. There'd be a lot of blame of the mother towards both the child and also the child's father. Um, and one thing that was a recurrent pattern is that the mother would keep coming back to me saying that there was an emergency. She needed to discuss certain factors related to the child's school, like have they made the right choice or the wrong choice. Um, and what what I ended up, realizing is that it is it was very likely that the mother herself, of course, also had OCD, and that she was kind of wanting me to be a part of the system with regards to reassurance seeking and providing a lot of inputs, needing to sort of talk about some of these concerns that she had about the child's school. And when this kind of occurred to me and I discussed it in supervision, then I started putting like more, firm boundaries, saying that, we cannot just keep discussing the same thing over and over again without the child. This is not something that is going to really work out for her. And then it gradually emerged that there were certain patterns. So the child's behaviors of becoming agitated, tearing paper, aggressing towards her mother would often happen when the mother would keep on bringing up these same themes at home. Her sort of obsessive ruminations about whether they're making the right choices or not, blaming the father and the girl, and that she would kind of become aggressive, and that would put a stop to this her mother's continuous narrations and anxious sort of ruminations. So, which is why I think it's important, like I said, to keep in mind about how the family is impacting the child and see if we can sometimes kind of just take a zoomed out sort of a lens in supervision, try to figure out what is it exactly that is happening, what is this family expecting of us, how are we kind of becoming a part of their complex systemic dynamics. Um, this is, of course, an intervention for eating disorders, especially anorexia, that has been extensively researched, and that's the Maudsley intervention for eating disorders, where the parents are given a very primary role when it comes to refeeding, when it comes to weight restoration, and this is something that is communicated to the child, that this is that we are giving the responsibility for correcting, your eating and your intake. We're giving the responsibility to your parents, and it's something that is, of course, closely mediated and observed by the therapist, including a few suggestions that they've given, that the therapist can observe a family meal and what are the kind of dynamics that can play out while this is happening. DBT-A is basically it's been adapted. It's DBT adapted for adolescents, and a lot of the elements are similar. Walking the middle path is one component that is specifically described for adolescents and their parents, where the endeavor is really to help parents understand what the child's perspective may be, and to kind of show them that it is important to really um, uh, work with the dialectic of, on the one hand, accepting that, okay, these are your struggles, this is, say, why you're behaving in this way, this is why you are watching so much, why you're watching screens for such a large part of the day. And with that acceptance, that we can then work towards behavioral change, right? So this is something, again, that I have found quite useful. This is an intervention. I've read up about it. It's more specifically for this ABC intervention is more specifically for adoptive parents, that is, parents who have adopted children, where it's very, very closely sort of tailored towards improving a parent's attachment sensitivity and really working on the parent-child relationship. So to kind of teach parents to provide nurturance even when children are avoidant or resistant, and how to work on their own issues, how to pay close attention to children's signals and needs and respond in calm and empathetic ways. So a little bit about how some of these theoretical frameworks play out in my practice. So, when it comes to attachment informed interventions, um, again, I've been quite heavily influenced by ABFT. So, I do try to look at what is impacting a parent's attachment sensitivity, how to improve proximity seeking by a child or a teenager. It really helps to observe parents and children together. So often parents find it genuinely hard to identify what their child is feeling, right? So I recently had a young child, he was about 4 or 5 years old, where his mother was the person who was really kind of complaining that, he's always very irritable, he's always whining, and I try to tell him to stop and he won't. And I actually observed that within the session, he came in and I tried talking to him, and he just started complaining of stomach pain, and he kind of scrunched up his face and said, "Oh, I don't want to be here. I want to go out." Um, and so, what I kind of felt is that this kid is probably anxious. So his father kind of stepped in, and I said, "Why don't you see if you can calm him down? We have like an OT room. He can go there." And then I kind of spent a bit of time with his mother trying to find out when these behavioral issues crop up. And they did seem to be, when he was sort of in unfamiliar environments or having to sort of meet new people, there did seem to be, his temperament seemed to be kind of slow to warm. And after a while, his dad kind of brought him back, and I let him know that he didn't have to talk to me if he didn't want to, and that he could just do some drawing, and he was fine. And so it helps to sort of explain some of this to parents, that it's not that he's being deliberately whiny, or not that he's um, that this is sort of bad behavior in that sense. And um, sort of really finding out what is happening in the parent's mind that is preventing her from responding sensitively. So this mom she had experienced postpartum depression. She would hear a lot from her family members about how she's not getting the child to behave properly, about how she's failing as a parent, especially from her own brother. So, so a lot of the work was also reflecting to them how they managed really well as a team, right? So when the father kind of stepped in and supported her, how, just how things worked out better and are likely to sort of work out better. Um, so a lot of this is kind of attachment focused and attachment informed. Now, ideally, if the parent is ready to engage, and I do offer this to a lot of parents, that it's not like you have to bring in the child every time, but then you can come in and we can look at what are some of the challenges that you are facing with regards to your parenting. What are some of the things that you feel are holding you back and preventing you from feeling that love or being more loving and nurturing. And some parents do engage, but a lot of them don't, especially if they feel that the child is kind of okay, or they've kind of done a bit of work and the child is kind of more regulated, then they often don't come back. But what a lot of the the writings on child and adolescent psychotherapy do tell us, and how it has been practiced quite a bit in other countries, is that parents are called in fact, for weekly sessions to really look at their parenting, their experiences of having been parented, really looking at building their reflective capacity. But we do it to the extent that the parent is willing to engage with us, and a lot of that will be also dependent on how dysregulated or how symptomatic the child is at that particular time. For adolescents, how this has helped is that many different things could come in the way of children speaking to their parents about what is going on with them. So, a lot of kids say that they find parents are dismissive of their distress. So, responding with statements like kids don't feel depressed, or if they say that I had a hard day, I was bullied in class, to say, why didn't you tell the teacher? Right? So, to kind of get into a sort of a solution focused way of dealing with things. Sometimes kids have come and said that, well, when I share something with my mother about how I don't want to live, or how it's really hard for me to go on, she kind of just freezes up, and I just don't know what is happening with her. I can't read her. And she also does look like that when she's angry. So I don't know if she's angry at what I'm telling her. So then it really requires a lot of work to go back to the parents, saying that, are you aware that, this is how you respond, and this is what she picks up, and how can we really then do this differently? Viewing a child's problem through a systemic lens. So this is something that I learned quite a bit more about, especially when I was part of the FT training program with Ashlesha and Catherine through Bauer Place. And this is really that very often in our practice, children and teenagers present as the problematic person. But to kind of remember that their issues may be deeply embedded in conflicted family dynamics. So, for example, um, especially when it comes to, say, aggression, acting out, there was this 11-year-old child whom I interviewed online. He was admitted at his rehab center, where he was admitted for aggression. And from the interview with the child, what emerged was that these episodes of aggression occurred only in the home context, and were directed largely towards his mother. And so I didn't really, have a really good sense about what was happening with him and his family, because his parents weren't available for interview that time. So generally, when you have someone with disruptive behavioral issues, you do kind of want to rule out, vulnerabilities like ADHD. So I asked for an ADHD assessment. I thought, okay, this is, this is one angle that we can look at. So when I spoke to his parents, and they came and met me in the clinic, what emerged, and this came out when, in fact, both of them, the parents had an argument in front of me, and the dad stepped out and he said, well, you can just finish this discussion on your own, since you don't value my point of view anyway. So what the mum said, that the child had in fact been witness to severe domestic violence perpetrated by his father towards her, under the influence of alcohol, and that his alcohol intake probably amounted to dependence. And What then seemed likely was that the child's aggression was shifting the problem away from the couple. And when he punished the mother for her mistakes, that time, in fact, the father's aggression towards the mother would reduce, and his position would shift from being a helpless witness to being the person in control. So after kind of having this understanding, of course, I kind of went back and checked to what extent, we're planning family interventions. But of course, the difficulty is that it's often hard bringing in family members. So especially family members who are a little more problematic or dysregulated, um, it was becoming hard to get them to come in for any intervention, and that was the same case for this child's father as well. So work is still ongoing, and we have to see what really we can do. Then by enactment, I essentially mean, and this is something that I may not do right away. So I usually tend to see the family all together in the beginning. I check with the child. I let the child know, or the teenager know, that I usually get some background from his or her parents, and I check with them whether the child would like to be present while I'm taking that history. And then they say, okay, how do we make a decision? So that's when I say that, well, if there is a lot that you want to say that you feel will be upsetting for him, and it may prevent me from talking to him subsequently, then maybe we can ask him to sit out. And sometimes the child or a teenager with themselves say that, no, I want to sit out. So that's how it goes initially. The parents share their bit either in the presence of the child or not. Then I speak to the child one to one, and then I check with him or her about, okay, there are some elements from our interview that we need to share with parents. Otherwise, they're not going to know what really we're planning, or how we can work out interventions. And then I call the parents back in and I tell them that this is what I feel, this is what we can do. And again, the choice is left with the child or the teenager at the end as to whether they want to listen in to what I'm saying. Um, Sometimes if I'm feeling kind of stuck, like um, especially when there are problem behaviors, and the parents would say that he's becoming angry, aggressive, that is when on a few occasions I've just said that, okay, let's just try and understand what happens, right? How do these arguments get out of control? And I kind of have them all in a room, and this needs a little bit of planning. So I say I want to really understand what goes on. So when you say that this child is becoming angry, aggressive, who says what? How does it really play out? And can you show me what happens? Especially referencing an incident from your recent past. So it's a bit of a risk, but if the family is on board, then it can really lead to you understanding how things work in the family much, 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 much better. So this girl whom I had done this with, she had been initially brought saying that she's not talking to her mother and grandmother whom she was living with. The mother was separated from her father. She's very uncommunicative, very sullen, very quiet, but then suddenly she'll just have these outbursts and she'll shout and she'll argue and she's completely unmanageable. And we were initially not really working with them together. We were trying to work separately, and she was very disinterested, very quiet, very uncommunicative in session. So I wasn't her individual therapist. It was someone else on my team. And we were completely stuck. So that's when I thought, okay, let's just, put them all in a room. I asked the mother, you bring in the grandmother, bring in her grandma as well. Um, and I said, okay, what happens? And then the mother, she started speaking about a recent incident when the child did not want to eat something that she had prepared. And the kid hardly said a word throughout that entire session. But it was the mom whose emotions just kept becoming more and more intense. And she was like, this is what happens. This is what happens at home. I'll be getting upset. All I want is some appreciation from her. All I want is to eat the food that I've made for her. Is this too much to ask? Um, and until she, really like lost her cool. And at that moment, the grandmother joined her as well and said, yeah, 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 she's ungrateful. She's this, she's that. And that is when the girl sort of responded to say, uh, well, this is like a completely unfair, like you don't care about me and you're always yelling at me. Um, and then the mom was like, this is what I have to do to get attention from her. Like, this is what I have to do. Now do you see what happens? And then on, um, what I just suggested was that what would it be like for the mother to kind of let the child do some of her stuff on her own? So, to sort of be responsible for her own meals and to, there were a lot of other issues that the mom had, like, she doesn't clean up after eating and things like that. So, to just let her manage some of her stuff on her own, to just take a step back, focus on herself and on her own self care and see what happened. And they didn't come back for a really long time, and that is just something that it occurred to me at that moment that maybe this is something we can try. And they didn't come back for a long time, so I thought, okay, what is happening with this family? And have things gotten worse? And was it completely wrong of me to sort of have them yell at each other like that in the session? But then the mom came back later and she said things are like absolutely fine. It was after that one time I've been focusing on myself, and 1 or 2 days she was just all over the place. But then she's also started kind of managing her stuff, and there's just less yelling. So sometimes having this sort of an enactment can give a lot of information, and it was something similar that had happened with a much younger child. That was Miss VD. She was about 4 years old, and the mother had brought her saying that she is very uncooperative. Again, keeps saying no to everything that I say. She won't listen. And I think what I had done is her the mother's father was also there in the family. She had kind of called him in because she said, I can't deal with this kid. And so when we put them all in a room and there were just some playthings, there was this tea set. What I noticed is that the child was quite happy to engage with the grandfather and sort of give him like a cup of tea and give him like a cupcake. But she didn't even want her parents in the room at all. And we had to kind of be very gradual and ask her permission to really get them in the room. And then she agreed that they could sit at like one far corner of the room. And it was only when this kid felt that she is going to be allowed to play the way that she wants and that they aren't going to interfere and that she has complete control of the situation, that gradually she was able to allow the parents to participate to a small degree in the play. And so what became evident is that there has been some kind of a rupture in the parent-child relationship, because it's with everyone else, her grandparents, and even in school, there weren't any issues. And then the mom kind of came up with, yeah, I mean, last month I was very stressed. I had a lot going on at work, and she was refusing to have a bath, refusing to eat. And then I just kind of forced her. I picked her up, put her in the bathroom, and poured the water on her, made her wear her clothes, and since then she's not been wanting to come to me. So, so it really, to kind of see what the child's behavior may be like within the entire family context, without really zooming in and viewing it as a problem behavior, something that needs more behavioral and operant interventions. It's something that kind of helps to understand where the focus of intervention should be. So this family didn't require too much support after that. I remember giving some letters to the mother's workplace saying that she may benefit from a little more time, because her child has certain symptoms of anxiety and she sort of needs to be there. We appealed to the grandfather that for some time he should be there within the family, and that with his support, gradually, the mother can uh, kind of sort of re-enter the child's world, and also some amount of work with the mother to understand how her anxiety can impact her attachment sensitivity, and what she might really need to do in order to really repair the bond with her daughter. And especially important to sort of remember, if we find that problem behaviors are more evident in one context, like for example at home, and if the child is kind of fine at school, then all the more to look at, is this really something that we would call like ODD or CD, or is it really something more relational that we're looking at? I'll just maybe speed it up a little bit. Mentalization theory is something that I have found extremely useful. Often there are these sort of cycles in which one family member loses their mentalization. That leads to other family members also losing their mentalizing. I recently had this mother daughter pair. They stormed into the room. They were late, so the mom was like, she's always late, this is always a problem, she never knows how to dress, and then just went on and on. And then of course the girl was like, well, whatever, you get the drift. And so it really becomes important to sort of reflect this back to family members, saying that this is all coming from a place of very high emotion, and also that because these are close attachment figures, that you're all the more likely to not think very logically, you're more likely to lose your mentalizing in certain situations, and to also look at a member of the family that one can appeal to break these cycles. So somebody who's likely to retain their reflective and mentalizing capacity even in the face of very heated emotions. So this is a vignette that I've actually taken from this book on NBTC by Nick Midgley, where the kid's name in that book is not Arya. I've changed that. So basically, about how this boy and his father get into like a huge argument because his father is driving him to school. He's left his lunchbox on the table, and how his mom can, just sort of step in, right? And what she might really tell him to sort of help him regulate and to kind of break the cycle where the boy and his dad are like continuously sort of blaming each other. So perhaps for her to say something like, yes, it wasn't I know you're upset because dad yelled at you, but you know, uh, let's talk about this later, or maybe he also has a lot on his plate, so something along those lines. Okay, so these are some commonly encountered challenges that I have faced in my practice, where families kind of tend to, sort of rope you into their way of doing things, right, and become a part of their dynamic. So families that tend to have uh, to not have a lot of internal reflective process, and to keep on asking like somebody else to pitch in with advice. So then they come and tell me also, you have to tell the child to do things in so and so way, like you have to tell them to exercise, and just make you also like an extension of their way of functioning. Then many families will come with the expectation that we will sort of ferret out what is in the child's mind and convey it to them. So there, I think it helps right in the beginning to kind of make it very clear that you have a right to know what is the direction that the overall framework of intervention, what we are trying to achieve, what we are trying to do, but that no specifics with regards to the content of what the child is sharing will be told to you both. And if there is something that I do share about what he or she has brought up, it will be with his or her permission. So if somebody just suddenly, if a parent suddenly calls me up and says, we have to discuss the last session and all of that. So, I tell them that I have not discussed this with your child, so I cannot, right away share something about what they've said with you. Um, yeah, it is a big problem when families have certain behavioral expectations, especially with regards to school refusal. Please just get them back to school, and sometimes they find it really really hard to understand that the more we focus on behavioral change, the less likely it is actually to happen. That's called the paradoxical theory of change, especially. Um, we would all be familiar with it, but especially in Gestalt theory, it's something that we like. I've really also started believing in. Um, then another difficulty is that when the most problematic family members never show up for sessions. So often we find ourselves working with one parent and the child, and through them we would get to know that there is another parent who is really problematic, maybe the source of a lot of conflict, a lot of physical and emotional abuse, but it becomes very difficult to rein them in. And there are times when I have actually kind of caught myself wondering whether I have also insisted enough on, inviting that family member into the session. So, we have a felt sense that, okay, we invite them in, things are just going to become chaotic, they're going to become dysregulated. So do we really want that? But there are times when the kids that I'm seeing in therapy will tell me that no one stands up, to my dad when he starts shouting. Nobody takes my side. Mom doesn't. Mom takes his side. You haven't said anything to him, and I would have called him. And I'm thinking of a particular teenager when I'm saying this, and it would have been so hard to say anything to this gentleman, or to even appeal to him that this kind of anger and punitive behavior is not likely to produce any kind of a positive change in his daughter. um like really hard, but even if you kind of stand your ground and say something, regardless of whether the person in question is going to reflect on it or not, what I did feel is that at least my client saw that, okay, this is someone, who made an effort to kind of say something to him. And, um, maybe she's trying to be on my side. And so then she kind of, when I kind of tried to intervene and interject, she came in and said, well, you can't say things like this. You can't call me a waste of skin, which is what he kept calling her. And um, this is hurtful. And yeah, so so sometimes I think we kind of also need to sort of take a step back from our work and really look at, um, so are we doing everything that we can? Are we thinking about what is happening with family members who don't typically step in? How do we involve them? Are we scared to involve them? Things like that. And this thing about putting on too many hats, this is something that I've struggled with. So um, even if you kind of make it clear to families that there should be someone different seeing them for medication, seeing the child for individual therapy, if they require like formal family therapy, that there should be somebody else. It often becomes really hard, and you'll send them to someone and they'll say, oh, but we don't like that person, something or the other, and then you just feel burdened to do too many things. But I've also found that when that has happened, I have not felt that I've been able to provide the best care, but sometimes I've felt compelled to do it. Okay. Um, so I'll go into a few of um, the case vignettes that I have thought of, where I feel I have done quite a bit of work both with the child and his or her parents, and where the work has been different. So in each of these three or four vignettes, the work has been somewhat different with the parents. So Miss R is a girl that I'm seeing. She's 14 and she's presented with symptoms of delayed onset PTSD. So she experienced CSA at the age of 6, And it was only much later, after she learned about safe and unsafe touch, that she began experiencing flashbacks and nightmares. And then she kind of recalled everything that had happened. She shared it with her parents. Then they went through the entire legal process. And then after that, they started coming to me for support with some of uh, these flashbacks and nightmares and PTSD symptoms that she was having. So the parents themselves were dealing with a lot. Um, they were also having to hear her say a lot of the times that you haven't been able to protect me. Why weren't you there for me? And so helping them process their emotions became a big part of the work, because they would kind of tend to get a little bit defensive and say that we didn't know, and how are we supposed to know? The perpetrator was with his wife, and we just never thought that there was anything. And to sort of help them understand that we would not want to do anything to kind of close down communication, and that um, if they sort of started becoming a little bit defensive, then she may not share anything more, right? Um, and that there would be a lot that would come up for them when she would, hurl so much anger, but that it's important, that it would be important for them to listen to her and sort of find spaces when they could regulate and process some of their own emotions. They would also want to know how to respond to her, when she had flashbacks, or what to say. um, so a lot of the work in involving like a little bit of stuff they already knew when they came to me, like grounding strategies and all of that, but for them also to sort of listen to her, when she was experiencing that, to say that we are there, you're safe now, whatever is happening to you now. It's not, she used to be very worried that the fact that she has these thoughts means that she's bad. So it's to help them understand the nature of flashbacks. This is a way that the mind processes trauma, and that we understand that these thoughts will come. So they needed a lot of support to understand some of these. And parents naturally are, they're often in a hurry. So they want to see her kind of back on track. They want to see her go on her school trips, and this kid just didn't feel ready, because she didn't she said, I don't feel safe, and what if I feel this way with my friends and teachers? What am I going to do? And so to also help them understand that this is a gradual process, and that we cannot just rush things, and especially within therapy, the fact that I'm a stranger, and that it's going to take her time before she feels like a felt sense of safety, and that we can't rush that. And so luckily, these her parents were extremely receptive, and they would understand that she would find it hard to talk about her trauma. And so it's not that, and they understood that I didn't want to sort of make her or force her to talk about it. So at the time when she would get the flashback is the time when some of the thoughts, some of the visuals, they would help her kind of jot it down and just have me read it, and then I would check with her, okay, is there any part of this that we can talk about, any part of it that you want my response to? And so we would kind of work through it, and are still working through it very gradually. This is another girl, very challenging, whom I'm seeing right now. She's 15. She has failed a trial of two antidepressants. Um, Extremely suicidal. Parents were completely unwilling to admit her anywhere, unwilling to get another opinion about brain stimulation strategies. So this was a situation. She has an individual therapist, but as a psychiatrist, I sort of feel that I have to take on the entire role of doing everything in my power to help them out. So I'm proceeding to see them on outpatient basis, of course, after having sort of done the necessary documentation. We've mailed them like a hospital referral form, so it's kind of documented that I have suggested to them that she would benefit from inpatient care. Then we have like this indemnity form as well, and they've gone through all of that. So the work really with her has been to understand why she's feeling so locked in with so much of her distress. And one reason for that is that she said, well, I just don't know what I'm feeling. I don't know, whether I'm feeling better with this particular new medication or not. It's just that suddenly there'll be this very critical inner voice in my head that will tell me, you're dumb, you're stupid, you couldn't even prepare properly for the last test, so you should just kill yourself. And to sort of explain to the parents that because she felt like she would not be understood, that she would tend to really mask, a lot of her distress whenever she could. So it's not like them, observing her sort of being functional, going to school, doing well in exams was at all indicative of what was going on inside. So to help them understand, her inner world, her subjectivities, understand from her why it has happened that she has felt she cannot share distress with them. And initially, she would not even say that it was anything related to the parents at all. And she would say it's to do with my bullying experiences. And so we just started out with, letting the parents know that she's had some very, very troubling and traumatic experiences of bullying, and sort of helping them respond in a way that is empathetic. And there are times when it has gone a little, gone into like uncomfortable territory where the mom would tend to sort of say that you should have told me then, I'm feeling so hurt that you didn't share these with me at the time, I would have done something. The dad saying, okay, yeah, she was bullied for being different, but she's got to understand that she is different, and so what, and she's got to toughen up. And there are times when I've been filled with a lot of worry because I felt I've not done enough to really understand where they're coming from, where some of these reactions are coming from, how they are landing on her. And these are some of the children and families whom I take back to supervision, and process my own sense of not being able to help them enough. And luckily, they have kept coming back, and now I just see that the parents are also kind of more in touch with how they feel when she discloses something painful. So the mom has, cried within sessions, and the girl has asked her, "Why are you crying?" And sometimes I have to give words to this mother, like not at that moment, but at other times. She's like, "What do I do when she asks me why I'm crying?" So, to sort of say that it's okay to cry, and you can just tell her that it's the girl would interpret this that, oh, I'm a burden on my parents, that's why mom's crying. To say that, no, I mean, I'm crying because I feel your pain, and I want to share this burden with you. This is not something that is something that I do not want to do. So again, this is very sort of attachment focused work. But what has now started happening is I mean, there is more communication that is happening. So when she's feeling intensely distressed, she's at least telling her parents, as opposed to being on the verge of kind of making an attempt, which is where we were. Okay, just wondering how many more I have. Okay, I think two more. Yeah. So this is a kid, 12-year-old with ADHD and adjustment disorder. He's had symptoms of adjustment disorder every time the family has had to relocate, when either parent's job has required them to. So currently, in the last 2 or 3 weeks or so, he's been feeling very low, irritable, basically depressive symptoms, after being told that they would have to move yet again away from Bangalore to Mumbai for his mother's job prospects. And this is a family that it's not like they don't have conversations with their kid, they do. But again, they tend to sort of intellectualize it quite a bit. So when I read, say, he's telling his mother that, I don't want to move, I'm kind of angry at you. She'd say, well, we're doing everything, that we can. And, we have involved you in all of the discussions. I've told you so many times that, if I don't have a job, we will have to sort of tone down, our lifestyle, the way we live, and kind of to get into this sort of very lengthy kind of. Some kids have actually labeled it as lecture mode that their parents go into. Yeah, so to kind of go into that kind of mode, and so this is the family whom I was initially I was seeing them all together because he would tend to get distractible, and I would find that there's not a lot of retention of the things that I'm discussing with him. But after all of these emotional disturbances kind of kept coming up, and I realized that this has a lot to do with his parents. I started seeing him separately and just trying to understand what his emotional world is like, and he would find it hard to really catch on to what he's feeling, and he's like, I feel so many different things. So it would help to kind of create a feeling map where I write down each and every emotion that he's felt over the course of the week, and then check with him. Okay, so what do you think has contributed to this particular emotion? Feeling sad, and he was telling his mom that he doesn't want to live. What is contributing to the anxiety? What is so to kind of map it out, and then with his permission to share that with his parents. And what really impacted his mother very deeply is when it was kind of pointed out as part of that feeling map that he has been feeling that she doesn't care about him, that she always breaks promises, that she doesn't value his opinions, and that basically the fact that when he's going through all of this and she's not around at all means that she just doesn't care. And so this thing that, okay, if my parents don't care about me, then what's the point in anything? What's the point in living? What's the point in getting up and going to school? And so I just kind of pointed it out to them, and I said, this is where we're at. And more than anything, like, we need to remind him and let him know that you do care about him. So how can we go about doing that? So I had suggested um, letter writing. So it was becoming hard for them to kind of communicate verbally. So for the mom to write a letter to him, letting him know basically in what ways she did care about him, and something that he could keep with him even when she wasn't around. um, but his mom is a more, again, problem focused, solution focused kind of a person. So she's like, okay, this is the situation, his trust in me is broken, I do not want this. And so she said, okay, we're not moving, I am going to resign my job, the one that I got in Bombay, we're just going to stay here. And so that's where we're at. And he has of course improved after that was disclosed to him that they aren't in fact moving. And I don't know whether they're going to continue work. Right, for the moment, they've said they'd come after his exams. But something that's also been on my mind is that um, the dad is there, right? He's there, but what really is his role? So this is a mother who is earning. They're quite clear that their lifestyle depends on her job, but this kid is also saying that he needs all his emotional support from her, and that he kind of looks to his father as being someone who can provide physical protection. And so the last time that I saw them, I just kind of his mom wasn't there. She was in Bombay. Just to open it up to them, saying that in what ways do you think that dad can pitch in, right? And also to check with the father. And the father said, no, no, but he's quite clear that he doesn't want me for any emotional support. But something that I have not been able to do, but that I want to do, is to kind of just sit him down and ask him that, what is preventing you from giving that emotional support. And I remember, as a part of that session, his mother had wanted to be beamed in over video call and all of that, but I kind of made a conscious decision to leave her out and to just see if we could work with the dad and this kid. So that is something um, that I think that if they do come back, is something that I'd like to do. Then another category of children and teenagers whom I feel really benefit from extensive parental involvement are those who are neurodivergent, like already many of the kids that I've spoken about. Um, and the kid whom I'm referring to now, he has Asperger's, and his mother has been a very critical part, of therapy. um, she sort of so initially, when he wouldn't really know about what we're going to do in session, he'd get quite anxious. He'd kind of start talking about his preferred topics, or he'd kind of go into self-talk. So it really helped to have his mother kind of explain to him from before what we're going to try to do in sessions, to kind of prep him. And then, when they'd come in to sort of, put it on the whiteboard that, okay, these are your obsessions, these are the compulsions. This is, why we're going to look at your mother not responding, over time, every time that you ask her for reassurance seeking, because it will sort of reinforce the problem, um, in future. And she also is able to point out, so at times when he keeps agreeing with me, and says, yeah, 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 oh, I've understood now, oh, I will not do this compulsion. She says that sometimes he just does that, when he kind of wants to close the conversation, when he's getting anxious. But we're going to need to return to this before and make sure that he's really sort of internalized it. So, especially for those who are neurodivergent, their parents really know them through and through, and so having them there, I think, has really made a difference to the work that I've been able to do. So, in summary, mm, what has worked for me is asking permission from the young person regarding what can be shared with parents. I don't always get it right. Sometimes I feel I may have shared too much or not shared enough. Usually, when I'm communicating to them about something that they feel that parents should know, I usually offer to have them there. So in that case, if I haven't been able to communicate it right, I mean, just to check, I ask them that, is there something you'd like to add, something that you feel I've missed? And they often do correct me, and that's helpful. And then I can just say, okay, I'm sorry, I didn't exactly say that right. Definitely making parents partners in the therapy process and helping them understand what is happening, because at the end of the day, they are the ones who decide whether to continue intervention or not. So leaving them out is really, it doesn't build trust, and the likelihood of dropouts is just that much higher. When parents have, when they need a lot of work, you can tell that there's just a lot going on for them, then I usually do not call for very frequent parent meetings. It may be like once in a month, but the frequency has gone up to once in a week, when I have felt that the parent himself or herself, usually herself, needs a lot of work to really reflect on how their behavior is impacting their child, and of course, if they are on board for it. um, so that has been something that has been helpful. Like I've mentioned, joint sessions involving more members of the family, that has been helpful to understand what are the kind of dynamics that are operating within this family. Attachment focused interventions, again, like I've said, is something that I really really go back to, and it's something that has helped sometimes even in within the space of one or two sessions. There would just be quite a bit of difference, and those would have been the sessions where, after it, the mother or the child kind of comes back to me saying, that was a helpful session, that really made a difference. A strengths-based approach definitely helps. Um, Sometimes parents will come and they'll say, well, I've tried so many things. We've tried reminders, we've yelled at her, but she, still won't brush her teeth right. A whole bunch of stuff. And then to just check with them, well, have you felt that you've never been able to get through to them? And which are the times when you feel you have been able to reach them, and what allowed you to do that, right? So that's something that helps them feel empowered, and also helps them realize that there would have been times when they would have done something effective. Walking the middle path, especially with regards to typical sources of conflict like screen time, clothing choices, friends choices, all of those very typical adolescent parent conflicts, it really helps to kind of table their perspectives and sort of help the parent understand that until you validate the position that your kid is at, they're very unlikely to be able to let you pull them in any other way. Sibling sessions have sometimes been very helpful. This is, of course, when the index child or teenager wants to have their sibling in a session and feels that there is some way in which um, things might be better. And this is especially when parental dynamics. Like I remember for one girl that I was seeing, the dad had a lot of anger discontrol, and this kid would just she would just refuse to let me speak to the father about it, saying, "You don't know him. He's just going to leave the session, go back home, and get even more, upset. And how will you control what happens at home?" And but she felt that maybe having her sister be a part of sessions may somewhere be helpful. And when the sister came along, she was much more vocal about. She was younger. This kid was The older one was 15, the younger one was about 11. And she was much more vocal about everything that she felt that the parents were doing wrong. Um, and she was the person who kind of said that, yeah, I think maybe I can kind of talk to mom. We're not ready to involve dad, but then maybe we can talk to mom and see if like the two of us together or the three of us together can, figure out some way for us to have just a greater sense of safety at home. And then we would work out what can be told to the dad to really be able to appeal to him. So then we'd say things like, well, she's very sensitive to loud sounds, like especially yelling, and that has been a trigger for her to really have a panic attack or a dissociative episode. So that's something that you need to be mindful of, without pointing fingers and saying that they've said that you have yelled, or to say that she needs a supportive environment and things like that. And somehow there's some sort of sense of shaky equilibrium now in the family. I'm not entirely happy with everything that I've been able to do, but it's something, and she's clinically better. So I'm hopeful at some time that the sisters will help me engage the parents more. And of course, emphasizing self-care for parents, acknowledging their distress. That is something I think that you can really make out that you've been able to reach a mother who's seeming very, or a father who's seeming very overwhelmed and burnt out. When you say, "Okay, I know you're going through a lot, and where can you sort of download some of this? How can you deal with some of this? Otherwise, you're not even going to be able to hear anything that I might have to say to you about your child." What has not worked is teaching parents regarding parenting. This is not so much something I do now, but yeah, when I started out, I think in my training and earlier on, I used to sort of prescribe things like, okay, half an hour connection time, have to do it, things like that, or using like telling all the PMT strategies for every family, using that one size all fit strategy. So nobody has complained to me about my sessions, but then they've come back later and they've said, well, we were sent to this other person for parenting, and they just gave us like a list of to dos and a list of don'ts, and what do they think at this stage of our lives that that's something we don't know. We have already read up about Chanakya and his style of parenting, and when we have gurus like that to learn from, then why should we sort of you know learn any of this or listen to any of this? So that is something that I feel is not really helpful. Not involving parents or very limited involvement is again something that I have made the mistake of doing. At times, like when parents haven't come forward and said that they want to be a part, or if the child has said, no, 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 I don't want them to be a part of it, I have not involved them to the extent that I should have. But ultimately, what has happened is that they would wait for like some turning point, like a board exam, and then after that, families like that I have just not seen again. So I mean, we've tried to even reach out, like what happened, but just complete non-response. So that really is not something that I would recommend. Sometimes we would identify parental psychopathology, but it has really not worked for me to immediately suggest that, okay, please consult this person, this psychiatrist, or see this person for therapy, um, that has sometimes proved to really backfire. And it is something that you have to really gauge that where they're at, are they ready to hear it? And sometimes it's a process that you have to work up to. So interventions based on reward and punishment, while they are kind of easy to do, um, and also in the short term, you might find that you're seeing a lot of results. But kids have come back and told me later that, well, of course, I stopped complaining about, things like my pain, because if I complained about it, um, I all my privileges would get taken away. I would not, get any screen time. They would say that, okay, now you're not feeling well, so you just don't do anything, right? So, um, yeah, so kids have later come and told me that it's it's not something that they find very helpful. I've even had kids use terms like this is a dehumanizing, unethical kind of approach and things like that. So I would just say to maybe use things like reward, punishment, um, consequences with just a little bit of caution. Sometimes we have very strong feelings towards a family member, and it's not helpful if we don't reflect on it and we just keep kind of forging through. Sometimes it happens and the caseload is high, but eventually that's kind of really going to it's just going to hit you, or they're going to drop out. This is a mistake that I've made, attempting online sessions when there's been a lot of conflict in the background. So this particular child, 12-year-old, things were kind of working out reasonably well. So he has ADHD, his mom has ADHD. The dad is somebody who, gets very angry, hits, emotionally abusive. And so it was essentially the mother and the son who was coming, and her needs were extremely high. Like her need to be heard, her need for support. So she just keep feeling that nobody is listening to her, that her son is not listening to her, and she would take up a lot of his session time. So she's a parent where I did recommend that I will see you once weekly, just to help you reflect on parenting, what you're doing, and all of that. And I would see the child also once weekly, and so it was quite boundaried like that. And then we had to switch to online work, for a bunch of reasons. And then during his session, she just kind of stormed into the room and she said, he's not cooperating, he's not complying, he's always late. Because he was late on that one occasion is the reason why his father came and punched him on the ear and perforated his eardrum. He's the problem, he's not listening to me, I feel like giving up. And at that time I felt a lot of empathy towards the child, so I kind of had to say that, I really don't know if making him the problem here is something that we want to do. And well, I haven't seen them after that. And his mom responded saying, well, I don't think you're hearing me. He is the problem. I'm the one who is overwhelmed. I'm the one who is burdened. And so that was an unfortunate turn of events. She has reached out over text after that, and I've said that online work is not going to be helpful, and we have to see what is the next best thing that can be done. Um, Not reflecting on how we're drawing boundaries with a particular family. Yeah, so this is something. Master V was a boy whom I never actually saw. His parents would keep coming. He always refused, and they would be very regular for sessions. They'd want a lot of my time. I think they really idealized me, and they'd want responses to each and everything, um, that each and every question that they had. So, what is it that I should do in this situation? So, if he does this, what should I say in response? And at that time, I just felt like, okay, I'm giving them parenting advice. So, and the mom would come in with so much distress and so much overwhelm. Oh my God, you're the only person who can save us. And um, like you have to help. I have all these questions, and then the dad would also pitch in, and they'd make these big Excel sheets or and I would totally get caught up in that and not realize that what I'm doing for them is not psychotherapy at all, and that this is something that I'm kind of becoming a part of the system. It's becoming enmeshed. Boundaries are becoming diffused. So it was after a while that I realized this was earlier on in my training, and when they came back for help with his younger sister, that was the time when I was also in supervision, and then I was very boundary. But this was a family that could not take that. Like they just could not understand how I had stretched so much for them before, and how I was, so different about it then. So this is something that I think, one has to reflect on, especially when families are pushing our boundaries and we have a sense of like, what is happening? Is this even therapeutic? It's really important to take it to supervision and kind of reflect on the overall, like the meta process of what is happening. Okay, I think I've kept talking for a little longer than I intended to. um I think we can maybe stop here for a while,
Yeah.
or I don't know.
Yeah. I think we could probably stop here for a quick discussion, Dr. Sreyoshi. Uh,
Yeah,
First of
yeah,
all, thank you for the uh, detailed talk. I think you've highlighted all the complexities of really working with children and family and adolescents in the family context. But I think it was a lot more simplified because of the real life examples and case vignettes that you actually shared with us. Yeah. So maybe we can check with the audience if and the participants if they have any quick questions, any quick thoughts. You can also
yeah,
put up your
yeah,
questions on the chat box.
yeah.
Um, and
So
and
I'm of course mindful of all the questions that were sent in, and I'm hoping some of those were covered while I was speaking. But maybe we'll, as you said, give a few moments if someone wants to chip in here with any burning questions, or else, yeah, we can go back to that list and see if there's something else that we want to cover.
so while the others are thinking, I had something to just probably highlight. I mean, there was this one particular slide which spoke about wearing too many hats as a clinician. And I think, particularly while working with children and adolescents, I find myself doing that. And then I need to sort of look at maybe take a step back and really understand my role here. And I think that's a spot that I'm frequently finding myself in. So I also wanted to just check with you with respect to when do we really sort of involve other people, like let's say consider family therapy, or let's say if there are the dynamics in the couple is really a problem, maybe
Hmm.
consider
Hmm.
bringing someone else in to take care of that. So what is that
Yeah.
line?
Yeah. So if I have thoughts about whether a family may need family therapy or couple therapy, I usually let them know early on that this is something that we should consider, we should talk about, but it's not like coming as an insistence from me straight away that you start individual therapy, couple therapy, family therapy, and all of that. But these are the ways in which it might help, and maybe we can just keep this in mind, and you also think about it, and let's talk about what it would mean for you to be engaged in this way. Also, if you have any questions about how it might be in any way additionally helpful, or why you feel I'm suggesting this, that is something that we can kind of talk about. But I usually kind of float it right in the beginning, because I don't want to be left sitting with that feeling that that I should have let them know that these options are available, and I didn't. Because I think, like especially earlier, I used to have this, I don't know, bit of like a savior complex that, oh, I have to just go in and do everything and, like save this family. And so I'm kind of very mindful, like to kind of let them know early on that these are all of our options. And to also tell them, that if there are medication options that may help, to say that if I'm seeing your child for medication, it's really not the best idea to also see him or her for therapy, because then we're going to end up talking about um, I'm going to have to sort of zoom out and, look at clinical symptoms and track those, in addition to kind of really zoom in on like particular aspects of their subjective experience. So it's like kind of tracking what's happening with the brain and then zooming in and looking at what's happening with the mind and, particular experiences and triggers. And I just say that all that's really hard to do. So yeah, sometimes I do want to go down the therapy route, in which case I don't, I say I can take up, and then I do tell them that somewhere down the line, if we do feel there's a role for medication, then I will suggest a colleague can handle that part.
Right, that
So
makes sense.
yeah.
So I think we also have a question here on the chat box. For anorexia, how do we engage parents?
Um, so that depends on what our target is, really. So if we are looking at a child or a teenager whose BMI is like precipitously low, then the main focus there is going to be refeeding. So there, it's almost communicated to the child that um, you may feel that some of your autonomy here is being taken away. But this is like one of those high risk kind of situations that we discussed, where we have to do everything in our power as the adults in your life to kind of keep you safe as a first goal, as a primary goal, right? And when you're out of that, when you're out of danger, then we're going to look at again, maybe if you feel we need to lessen the role of your parents, or have them be involved less. But I would say that I mean, that's a situation where you cannot do without the parents. So to kind of like make it very clear to the child and the family that this is a high risk situation, one of those that we discussed where parental involvement is inevitable, similar to say self-harm, like, or suicidality, where you say that um, we have to have them involved, and that's in the interest of your own protection. So yeah.
Mhm. Right. Uh, Purnima, do you have something to add?
Yeah, I have a question to ask actually. So I guess that's has been a very question which has been going doing rounds a lot, and I still don't have answer. But I just want to ask you, Sreyoshi, like, what are your thoughts? Like, for example, when we're dealing with sexual abuse, children, children struggling with sexual abuse, and reporting becomes important, but family members don't want it to happen. So how do you bridge that gap? What do you do in that kind of a situation?
So this is something that it's kind of just really been extensively debated just after mandatory reporting was introduced. A lot of professionals were very anxious about what is going to be the consequence if we don't report. So, we have gone to the extent of telling the family very early on that we're encouraging you to take the steps to report, but otherwise, we're going to have to. Um, and it has happened that families have dropped out of treatment altogether as a result of that. Like after extensive discussions to kind of explain why this is important, uh, we've had the particular family that I'm thinking of. The mom said, "Well, if you report this, we're all going to commit suicide, something like that. We can't have this get out." But when there was the insistence from our end, then they just dropped out. So then, we kind of discussed this, and how we approach it is that, we kind of keep it as an ongoing discussion. And we report when the family is ready. And in the documentation, we write that this is an ongoing discussion. The child is safe. There is no likelihood of any exposure to the perpetrator again. The family is aware and they have taken that responsibility. And that we're, having the conversation about disclosing. And that we feel this is in the best interest of the child. So if anybody asks you, you're acting in the best interest of the child, because they're not going to come back to you if you say we are going to report tomorrow. And that's something that has actually happened.
Right. But as a private practitioner, do you find that it's a very tricky situation? Because in an institution, obviously you have a, cover
Yeah,
up.
it is very tricky. So it helps if you're in a private setup, and where I am now, where you have a legal team, so you kind of keep people informed, and you write that I've kept people informed. It's all a question of not operating also in isolation. Yeah.
Mhm.
Thank you. That was very helpful.
So there's also a question from Karthik, who says that when you're working in school, adolescent children come without parents' knowledge and they don't want parents to know about it. So
Hmm.
what are the things to do or things to take care of in such cases?
I think we can respect their decision. A lot of the times, kids have come and told me that I went to the school counselor, I felt supported, but then I found that she's told the principal and she's told my parents, and so there's no way I'm going back to her. We don't want that to happen, because a school counselor can be an extremely valuable person. If the child is feeling distressed at school, they can go to her. If she can maybe help with the nurse or someone to give SOS medications, right? So I think unless it's a very high risk situation, I don't really see the problem in respecting a teenager's wishes for privacy or confidentiality. Again, so non-suicidal self-injury is a kind of a gray zone where if it happens in school, no school counselor is going to say to the child that, okay, I'm going to keep this under wraps, right? And this is again something that we can debate, like, should we disclose, should we not? Like, we know the intent is not to end life, the intent is to alleviate distress, but at the same time we know that there is that much distress, and that NSSI can be a gateway to more serious suicidal behaviors, right? So I think you have to consider the best interest of the child in that situation. Like, we have gone and disclosed, and it has led to like a complete therapeutic rupture, because the kid is like, I told you not to, and you did. If they don't come back to you at all, then there's no work that you can do. So I think whatever is your attitude to confidentiality, to make that very clear to the teenager in the beginning itself. What you will, when you will breach, when you will, hold that confidentiality, and to only do so according to the clauses that you've identified in the beginning. And also after letting the person know that you're going to inform so and so, like ABC, to the parents. And they find it very troubling if the therapist or the counselor, school counselor, is having like parallel conversations and they have no idea what is being said and whether everything that they have disclosed is being shared. But again, it's
Also,
tricky. It's very tricky, because principals and coordinators, they like to be kept fully informed. How is this child, and what do we need to know? And then they will send letters through the school counselor to you saying, we want to know about this child, and then we'll have to respond back saying, this is, we don't engage in third party communication. At best, I can give a letter addressed to the parents, that this is a summary of the work that's been done, diagnosis, recommendations. If they want to share with you, they will. But then the issue is that sometimes, if parents don't share certain things with the school, they tend to, the school often becomes a little bit problematic. So either they'll say, we can't keep this child for so and so reason, or they'll start making up some reason why they may not be able to support the child. So it's, yeah, maybe we need to involve school counselors and principals in this discussion to see what best can be done. But it's a very tricky and kind of, yeah, difficult area.
mm, also, as an extension of this, I think sometimes clinicians are also put in a spot where we feel like we're holding the child's secrets, which may or may not be risky at this point of time,
Hmm.
but dynamically we don't know in the long run. I mean, simple things like maybe substance use or being in a
Yeah,
relationship
yeah,
with someone who's emotionally abusive, things like that.
absolutely, absolutely. And it's especially tricky if the parent comes to you later and said, "Well, have they said anything to you about, when they
Hmm.
smoked and when when they drank?"
So, how do you respond to this, Dr. Sreyoshi?
I thought you might ask, so I'm trying to think of now how I have this. I think I let them know that, see, experimentation is a part of adolescence. So I would not be too worried if there is occasional experimentation. So I kind of hedge like that and say I would let them know that if there's something that I feel is really alarming, and I will keep your child in the loop and let you know.
Hmm. I think sometimes we also have parents who sort of reach out to us and say that, oh, you know what, I found this about my boy, my girl, and I would want to talk to you in private, not
Yeah,
in front of my child. I think that
yeah,
also sometimes becomes a very tricky situation to deal with, especially when the child or adolescent
yeah,
doesn't
yeah.
want us to speak to the
Mm,
parents.
absolutely. So I usually tell the parents, see, whatever material that you're giving me about the child, unless you allow me to share it with them, there's nothing I can do with this information.
Hmm.
So recently, I had a mom who came in and said, "Oh, this my daughter has found out that if she smokes up, it's going to help with her uh, concentration." And so you must indirectly, find out if she is or if she isn't, and then tell her that that weed is not going to help her with her concentration, and that it's going to be bad for her, and all the other negative effects of marijuana. So I told the mom, I can't. I don't think that's something that I can do. I cannot just put that into the conversation. I can ask her in general about substance use, but if she denies it, how am I going to bring in this angle that that your mom knows that you've been talking about weed improving, or that you've been concentration, or that you've been thinking about experimenting? So I tell the mother there's nothing I can do right now with this information, and you need to be mindful of that before sharing something with me. You know, and we need to see what is keeping you from sharing this with your daughter. Like, what is it that you fear will happen, and kind of have those conversations.
Yeah. Also, I was wondering again regarding the legal aspects of this when parents demand, let's say, a record of what the session was about. What
Hmm.
what legally, what stance do we have? Are we
Legally, I think you are in every right. I mean, this is what we do. You have a right to provide like a session summary, and this is if you're seeing the child for psychotherapy, to provide like a summary of the work that you have done. And when parents have asked me for this, I've prepared the summary. I've showed it to the child. I've said this is what I have been thinking about sharing with your parents. Are you okay with me sharing this? And then they have made changes to that, and then I've gone and revised that, and then finally mailed it to the parents. Essentially, what they may be looking at is kind of like an outline of how you're doing the work that they have asked you to do. And if it's for psychiatric care that they want like an evaluation or something, and I'm not seeing someone for psychotherapy, then essentially it's only diagnosis, treatment recommendations, and that's it. It would just be like a 3 or 4 line.
Mm, yeah, that makes sense. So we also have another question in the chat box. I think this would also come up in the email. The difference of
Hmm.
generation gap.
Hmm.
How do we handle, especially with dressing sense and food habits?
Yeah, yeah. Um, so I think I kind of start out with. So these are also often, before you kind of attempt a conversation between the child and the adolescent, the child and the parent in your presence, they might need some work on their own, to work up to that joint session. So to kind of understand from the parent, um, where are these anxieties coming from? Like, you're complaining about the way she dresses, and you're complaining, but Where are these anxieties coming from? And then they will say, teenage pregnancy, and then, well, if you check with them, well, have you shared that this is that this is the place where it's coming from? They'll be like, no, no, no. Why will we, share all of the reasons why we are worried? So it's very often that the child or the teenager does not know, and they will not know that this is coming from a protective place, right? Because it's cloaked in so much anger and so much, yeah. So to really tell them, okay, so this is what you want, like you want to kind of protect her, and you have already tried different ways in which to get this through. Like what has worked, what are you quite certain has not worked? Why do you think it hasn't worked? How do you feel safe? Your spouse or your parent wants to change a particular behavior in you, that if they kind of just yell at you and tell you do this differently, how would you respond? Or how have you responded to that? What has helped you with behavioral change? What kind of language has helped? And then to kind of help them see that if um, somebody speaks to them as though they are on their level, which is also what adolescents want. Like you don't want to be talked down to, that it's going to be much easier to even accept what the other person is saying. And so then how do you kind of modify your language and speak to your teenager as though they're not someone who needs, you know, um, scoldings or lectures, but someone whom, try to understand. Like, what is their perspective? How do we get through to them? How do you think you would get this through to a friend of yours? And to really work with them about some of that. Um, and also with the adolescent, that where do you think, like, what is going on for you? So there is screen time, but what does screen time really mean for you? um, and then a lot might come out. There are fights at home, which is why I'm on the screen. Like, I feel I can't even step out of my home, right? Or it helps me with my mood, and these are all things that the parents may not know about. So it helps to kind of understand where they're coming from, and then see if we can gradually bring some of these perspectives uh, on the table in like a joint session also, and then get them and turn the conversations over to them and see if they can continue it at home.
Yeah, that makes sense. Any other questions, any points of reflection from the participants? You can always just unmute yourself. And Devanshi, would you want to add something?
Hi. So basically, I think I do absolutely agree with the idea of bringing in family, bringing in the parent when we're dealing with an adolescent. I think the hesitation that comes from me personally is that how do I maintain my neutrality? So once I get a lot of information from the mother of or the parent of their own challenges, then it becomes, I find it harder to then sort of I'm sitting with that level of information, but the child isn't. So bridging that gap, it just gets more. So I think I hesitate to do that, to bring in the parents because of neutrality.
Hmm.
What is it that has worked out for you?
Hmm. Yeah. I think when I'm seeing a child or a teenager for therapy, mm, even in a parent meeting, I think I kind of try to keep it in the back of my mind that I am looking to support this person um, in parenting their child in a way that is effective or helpful. So whatever, and regardless of what she brings in, right, to really bring the conversation down to, well, in these interactions, with your child, how is all of this really playing out? Um, and if she's bringing in a lot of stuff which she or he expects my help to process, I think I would say that, but that's not what we're trying to do here. We're looking specifically at your role as a mom or a dad. We're looking at these interactions or these relationships between you and your child. I understand that there's a lot, right? But let's return to the work that I'm doing with you, and to sort of bring the adolescent into the room even then,
Hmm.
even if they're not there. Yeah.
And yeah, I think that makes a lot of sense. And would you also sort of give an insight to the adolescent of what the parent is going through?
That depends on if the parent wishes me to,
Hmm.
um, but and if the child also requests it.
Hmm.
But I don't specifically make like a mental note of conveying what happens in parent meetings to the child.
Hmm.
Just maybe give a short summary. If there are specific questions that the child has, then we may have to take those up.
So
But a
this
lot
sounds
of the things on the agenda for the parent meetings, um, the child would already be aware of,
okay. Hmm.
because I would have discussed that with them from before, that this parent meeting is coming up and what can we table there.
Hmm. Hmm.
Unless it's like the family that I mentioned towards the end, where the mom was very overwhelmed and I was seeing her weekly. So there,
Hmm.
the explanation to the child did not require a big explanation, because he knew that his mom has a lot to share and that she takes up so much of his space. Um, and that's how she is even at home. So
Hmm.
he knew that I'm giving her the space to process some of her emotions, especially towards parenting.
Hmm.
He didn't need more explanations than
Yeah, because I think you also risk the fact that then the child will completely sort of placate all the responsibility of whatever's going on to the parents and what they're bringing in and not take any ownership also.
Sorry, what did you
I
mean by
was,
that?
I was wondering that if one, so hypothetically, if the mother is extremely anxious and a lot of the parenting issues are coming from there, and
Hmm.
if over revealing of that to the child would
Hmm.
probably also mean that the child would completely blame the mother for everything and not being able to take ownership of whatever is there in their control or in their capacity to sort of
Hmm.
navigate challenges in the system.
Yeah, that hasn't happened so much. Um, yeah, somewhere it happens in earlier stages when level of engagement is not too deep, where
Hmm.
the kid would say, "It's my parents who need the therapy, not me.
Right.
Why am I even here?" You know,
Hmm.
it's all their fault. They're responsible for everything that is going on with me. Um, but I think after they discover the benefits of a therapeutic space, and when they also understand that you're not going to be pressing for behavioral change,
Hmm.
you're not positioning yourself as a parental figure,
Hmm. Hmm.
then it doesn't become like, oh, you're being forced to come for therapy.
Got it. Yeah. Yeah. Fair enough. All right.
If
Thank
they're being forced to come, that's not going to engage, that's not going to lead to any
you. Correct. Yeah.
yeah, positive.
Okay. I'll take a leave here. Thank you.
So I think we also have a very specific case here brought up by Hasna. In the context of a 14-year-old girl with superior intelligence and giftedness, presenting with emotional instability, self harm, difficulties with social interaction, low self worth, who has fine arts degree at the age of 13, with a family history of domestic violence between parents, an untreated history of narcissistic personality disorder in father, and recurrent depressive disorder in mother. How much do we include family interventions, especially when there's ambivalence in parents in engaging in the session? Is it recommended, or what are the things to be considered? Um, an online individual, it's an online individual therapy at present.
Okay, I'm just reading that.
Hasna, would you want to maybe bring this up? Yeah.
Yeah, hi. So I know it's a very specific case. So this has been a girl I've been seeing for quite a few months, and it's currently an online session. So all of the details has been put through by the mother initially. That's when I got to know that the father has NPD, and she's being taken. Mother has been taking psychiatric medications for RTD, which she's not considered psychotherapy, or even with the idea of couple therapy, the father is not willing to. So this child, she struggles with, lots of things, and there's been episodes of self-harm, and so she's been getting better on those aspects. But whenever there's some conflict at home, all of her symptoms kind of spiral up. So I had, at one point, I'd involved mother in the session where, some of the criticisms with the mother and the child has been discussed, and it has been we could resolve it like when the mother was present with the adolescent. But then when we followed up for the next session, the mother was like, I don't think I have to be in the session because everything's all right. So somewhere the mother wants to pull away whenever there's a chance, but at the same time she's like, the girl doesn't miss any session, so it's very consistent that way. So it's a very ambivalent situation, and I one point did try to address that, either they have to take couple work because things are getting, and the mom came up with a solution that maybe we can send her to a hostel, like after she finishes her 10th or something, which seems like a good recommendation. But at this point, what can I do? And this is a girl with who has superior intelligence, and she's actually really good at art, and she has a finance degree. So the mother kind of reinforces that aspect too much. She's like, why are you not happy? Like you have a finance degree, why are you not drawing? Like why are you wasting your time? So that's the kind of criticism that goes on. Mother's like, we're trying everything to do things for you. She also has two younger siblings. So that's the kind of interaction between the mom and the child. So I'm just wondering, 'cause it's online there in Qatar.
Okay.
What do you do?
What does the girl herself feel about family involvement? Like, what is her stance towards that?
Yeah, initially she was very much hesitant because she was scared of her dad. There was one session with dad initially, and he appeared very, very charming, like all good with what's going on and all that. And I did not engage with the father later because he was mostly not available. Girl was hesitant, but at some point when it was discussed, she was okay, and that's when we had the session with the mother. And she was okay to continue it if mom was willing. But the mom felt that it was not necessary because there's no problem going on between them at this point. So the girl is okay. Girl is
Yeah.
okay in engaging with the sessions, but she's concerned about the conflict that may go on, whether the mom would express the anger later after the session, yeah, stuff like that.
Yeah. I think it might help to just have a conversation with her mother
Mhm.
about why she feels that, reflecting on her relationship with her daughter and seeing how she can support her in some of the ways that you support her in therapy, why knowing about that is something that she feels is not helpful. So, what is getting in the way of that? The girl feels supported by you to tell you
Yeah.
certain things, right?
Yes.
But what is getting in the way of the mum being a part of that process, right? And
So sort of,
it may happen that if you have this conversation with the mother, she'll say, I have no bandwidth. I simply I can't,
True. Yeah.
you
Because
know,
she's
that
actually on medication and
yeah,
issues.
that, you know, I feel I can barely get through the day myself. Um,
Yeah.
right? But then you'll know that these are her limitations, and you know, then to look at, okay, is she then in individual therapy at least for herself? You know,
So
what
that
is the
has,
situation? Like, can she at least harness some support systems to make her load less? Kind of look at it
yeah.
like that. And if she
Yeah.
feels supported, you know, in
Mm.
that way by you, then she may
Yeah.
gradually kind of also open. Like sometimes parents are also very worried that if they come into sessions that you will kind of scold them about all the things that they're doing wrong.
Mhm.
But just to, you
Yeah.
know, say that this is just like an open conversation, you know, just I'm not I just want to understand where you're at.
Yeah. So at this point, I think I've had a couple of individual sessions with her, like just to reflect on the girl's work. So again, that has been the major concern is that one thing she doesn't have a support system because she is in a difficult marriage and she's not ready for divorce because she's worried for the children. So she's in that loop and she said that she had tried individual therapy multiple times, but every time she goes see a therapist, they recommend divorce. So she's not going to be,
Mhm.
anywhere near that. So I have recommended that, we can actually work on, I mean, not as I
Mm.
can recommend, but she's still ambivalent. She's like, no, I'm taking medicines. I see my psychiatrist and it's going on. But
Mm.
uh, so that's her stance. So she's ready to put in work, but when the work has to be put in, sometimes it's missing. So the
Mm.
ambivalence is not evident in this, though I'm not going to do anything. I don't have the bandwidth. She doesn't say that directly, but when we had the session, she was like, for the next session, I think it's sorted. Like she's good. We're good. I'm very supportive. I'm doing the best I can. In a way, she is. But at
Yeah,
the
yeah,
same time,
totally.
whenever there's a conflict going on within the couple, the anger, there's triangulation going on. So it's a lot of things. So,
It
so
displaces the anger onto
yeah, onto
her.
the yeah. So I did from your presentation, I did think of the bringing in the siblings because there are two younger sisters, which
Mm.
the girl is comfortable with. So I was wondering whether that can be a
Yeah,
place
yeah,
where, or
yeah,
if there's anything else.
yeah. I mean, you can only keep trying, right, from your end to
Yeah,
engage her to the extent
yeah.
possible. Um, yeah, and also to get the girls help to understand, okay, so when mom is kind of, you know, hurling so much anger at her, what would it be like for her to sort of put a
Mm,
boundary there
mm,
and say, you're hurting me,
yeah,
you know,
yeah.
I'm going to
That's
just
one
step
area
out.
we've been working on
Yeah,
because we've
yeah.
done some amount of,
And then if she's tried something like that and, you know, something has gone really off from the mother's response,
mm,
then, you know, to tell her that, well, you're doing what you can from your end. But I think this is something specifically that I would like to talk to your mother about. Like when she's
mm,
trying to protect herself, she's trying to place a boundary, but if the mom is just not letting her,
yeah,
then it is her right, you know, for you to speak for her
okay, yeah.
to the mom about something uh, like that.
But
But your targets with this girl, I think, are essentially going to be to just support her and keep her moving forward, you know, with the
yeah,
hope that one day she's
yeah,
going to be out of this situation. So it is
yeah,
essentially going to be how does she cope? How does she just have enough external
yeah,
support systems just to get through,
yeah.
really?
So that's what
Yeah.
I'm trying to do, but
Yeah, yeah,
sometimes
yeah.
it's sort
A
of
lot of
difficult.
the deeper processing and all will happen after she's out of this environment. Now she just has
Yeah,
to survive it.
yeah, but that's helpful. Thank you.
Thank you, Hasna. Okay, so I think I'm also a little mindful of the time. It's 4. Yeah. So maybe we can end the discussion here. Yeah. Thank you so much, Sreyoshi, for this very insightful discussion. I think it was really helpful, very, very practical, and things that we can actually take it to our therapy/psychiatric care room. It was a delight having you here. Thank you all for
Thank you.
joining and making the discussion lively. All right. See you all maybe next month.
Thank you
Bye-bye.
so much. Thanks, Sreyoshi.
Thank you. Thanks, Devanshi. Thanks, Ruchi.
Bye.
Bye. Bye.